We're here, registered physiotherapist. Today, I'd like to talk to you about the treatment for what's referred to as a stinger. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially what a stinger is, it typically takes place when somebody falls, so there's some sort of trauma involved, and the neck and the shoulder, they basically move in opposite directions, right? So the most common place that you'll see this is somebody who falls off a motorcycle. Okay, so they fall kind of directly on the shoulder gets depressed quickly. And what ends up happening, right, is that the patient will end up getting a really weird sensation down the arm. So basically the nerves, specifically the nerves in what's referred to as your brachial plexus, which is just a bundle of peripheral nerves that come together right around this area, just in the sort of shoulder region. It gets overstretched. And then again, as a result of that, we get this kind of weird sensation down the arm. It feels like a stinger, right? So it feels like some numbness or tingling and a weird sensation. So essentially, the two most important things that you have to do in treatment for this is, number one, the position that's going to provoke symptoms typically is when the shoulder is more depressed, right? So one simple thing that can help with a stinger is just to actually elevate the shoulder, right? So have the shoulder supported. A pillow tends to work really well. And what this will do, it'll take that stretch off of the nerves, and then ideally will help with some of the peripheral symptoms down the arm. Next phases, so to speak, with treatment with this is, in a lot of cases, we'll want to actually work on shortening and strengthening the upper trap, the levator scapula. So some of these muscles that will essentially help to elevate the shoulder. So I'll have patients do a lot of upper trap type of work, right? And by doing this, again, what we're trying to bias is that elevated shoulder. So a lot of times after these injuries, you'll see the shoulder blade and it'll be quite depressed or lowered, right, on that affected side. And then finally, we'll eventually want to do some form of nerve flossing or mobilization of the peripheral nerves that run down the hand once the sensations have started to settle down. So again, with this, typically we're going to want to bias the shoulder in an elevated type position. And then there's different types of, they're called nerve flossing type exercises, where basically we're mobilizing the nerves once we take the nerves and the bundle of nerves known as the brachial plexus off of that really big stretch. So you do want to, again, make sure that you're not creating symptoms. You do want to elevate the shoulder. For some patients, there might be a period of time where they're going to actually be in a sling, again, just to bias that elevated type position. And I find it's really important just to elevate patients around the positions that will provoke and what will make it better, right? So again, it's really straightforward. So positions that mimic the injury are going to potentially cause more symptoms down the hand. And then when you do the opposite, that should actually relieve the symptoms. If you have any specific questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.